Welcome back to my channel. In this video, I'm going to show you how to use kinesiology tape for arm lymphedema to decrease the swelling in your arm. If you or someone you know is struggling with arm lymphedema and swelling, this video is for you. I'm Alex Hill. I'm a board-certified oncology physical therapist and a certified lymphedema therapist. Let's get taping. Before we dive into the benefits of kinesiology tape for lymphedema, let's quickly explain what lymphedema is. Lymphedema is a chronic condition characterized by the buildup of lymph fluid that causes swelling, and it often occurs as a result to damage to the lymphatic system. This can happen after cancer treatments like surgery or radiation therapy, or if you've had other trauma or infections in the area. Now, let's talk about how kinesiology tape can help manage arm lymphedema. Kinesiology tape is a stretchy adhesive tape that can be applied to the skin in various patterns. It's thought to work by gently lifting the skin and creating more space for the fluid to be able to get back into the lymphatic system. It works best with movement, so if you need exercises for arm swelling that you can use while you have the tape on, make sure to click the link above, or I'll include it in the description and at the end of the video. Before using kinesiology tape for arm lymphedema, make sure that you consult with a lymphedema therapist first or your healthcare provider. They will assess your specific condition, your presentation and swelling, and determine if kinesiology tape is appropriate for you and what the best application method is. When applying the kinesiology tape, it's important to remember a few key points. First, the skin should be clean and dry before applying the tape to ensure proper adhesion. The tape will not stick to your skin if you have lotion or oil on it. You also do not want to place the kinesiology tape over any open areas like wounds or cuts, and not over any areas of active malignancy. Second, cut a small piece of the kinesiology tape and place it on the skin in the swollen area to make sure that you don't have an allergic or irritative skin reaction to it. Most people tolerate it well because it's just being used very gently for lymphedema, but it's always best to check your skin first with a small test strip. Third, kinesiology tape should be worn for just a few days before you replace it. But if you notice skin irritation, swelling, discomfort, don't wait, remove it immediately. After you remove the kinesiology tape, always check your skin for any irritation. And finally, kinesiology tape can be a very valuable addition to a comprehensive lymphedema treatment plan. That should include manual lymphatic drainage, compression garments, exercise, and skincare. The kinesiology tape, as great as it is, should not be used alone. All right, all you're going to need to do for the kinesiology taping is the kinesiology tape and a pair of scissors. The tape that I'm using is on a roll and it is not pre-cut. However, there are some pre-cut types that are available. I do have those in my Amazon storefront. Step one is going to clean and dry the skin in the area that you're going to place the kinesiology tape. If you have swelling throughout the entire arm, make sure that the arm is clean and dry from the shoulder all the way down to the hand or the wrist. Step two, you're going to measure and cut a piece of the kinesiology tape, and you want to measure it for the length of the upper arm and the lower arm. You're going to cut 2 pieces for the upper arm and 2 pieces for the lower arm so that we can cover the front and the back and cover the entire arm. You're going to round the corners of one end so that the tape does not get pulled up as easy. Then you'll cut strips along the tape, leaving an inch uncut because that will be our anchor. Once it's cut, I think it always kind of looks like a jellyfish, but it's actually called a fan pattern. Next, you'll apply the anchor, so you're going to rip the paper and peel off the paper just at the anchor. You'll place the anchor up at the front of the shoulder and rub it to activate the adhesive. This is where we're directing the fluid to, is the anchor. Step 4 is going to be applying the fan strips. You'll first take a strip and peel the paper back to the last ½ inch or so, and you're going to pull it only 10 to 20%. You are not pulling that full 100%. So what I like to do is pull it 100% and then 50%, 25%, and then a little bit less. So this is very gentle tension. Then it's time to do the back part of the arm. If you have someone who can help you, this is a lot easier, but you can also do it in front of a mirror. So you're going to rip the paper, peel it off at the anchor, and you're going to place the anchor up at the back part of the top of the elbow, and you're going to rub it to activate that adhesive. Again, this is where we're directing that fluid to. Next, you'll take the first strip and peel the paper back to the last ½ inch or so. And again, you're only pulling that 10 to 20% of tension, not the full 100%. And as you start to get the fan strips laid down, it's okay to overlap them, especially if you have a lot of swelling. Now we're going to move down to the forearm, and we're going to do the same exact thing that we did for the upper arm. So you're going to place the anchor above the elbow crease at the outer part of the arm. You're then going to pull that 10 to 20% of those strips coming down the arm, and you're going to make sure it covers the whole part of the forearm. Finally, we're going to do the same thing on the inner elbow. Above the elbow, you're going to place the anchor and then pull that all the way down, and it's going to cover the opposite side that you just taped. Again, totally fine to overlap those strips. Now that we have the whole arm covered, we can also use additional strips to move that fluid out of the arm. So if you don't have any damage to the lymph vessels and the lymph nodes on the opposite side, we're going to use the tape in that same fan pattern and move it across to the anchor to the opposite side. If your lymph nodes have been removed or you have damage to this side of your lymphatic system, I would skip this step. So you're going to place the anchor at the opposite chest near the armpit, and just like with all the other stretch, we're just doing about 10 to 20% stretch. And there you have it. You've got the full arm, and we're helping to move that fluid out of the affected area. So when it's time to remove that tape after a couple days, be careful and go slow. You want to be gentle as you remove it. You're not just ripping it off. That can cause more irritation and inflammation. We don't want to do that. Give some tension to the skin as you gently pull it up, and you can also try massaging oil like coconut oil or olive oil into the tape, or even hair conditioner, for a couple minutes to loosen the adhesive to take it off easier. If you found this video helpful, please give it a thumbs up and share it with anyone who might benefit from this information on using kinesiology tape to decrease the swelling in their arm. Also, make sure to subscribe to my channel for more videos on lymphedema management.